Yeah, so I like to tell our audience that I am with Dr. Lalit, who has secured a rank 110 in this recent NEET PG exam. So, Dr. Lalit, tell us all about yourself. Which college you did your MBBS, and how did you prepare?
So I did my MBBS from Maulana Azhar Medical College, Delhi, and I joined DAMS in my first prof towards the end of my first prof, and I was a member of the regular face-to-face classes, and so I attended many offline lectures, and when it was not possible, I used to attend online lectures. So and then in my final year, I also attended TND.
Okay, so that means that you started your preparation at the end of your first year.
Yes, sir. Sir,
Okay.
during my first and second year, my target was not NEET PG. It was just to understand the topics. I used to uh, attend those lectures and used to study standard books.
Means कि you want to make your concepts crystal clear
Yes, sir.
during
Yes,
those
sir.
classes so that
Yes,
you can
sir.
apply those concepts in your major subjects like clinical subjects. Okay,
Yes, sir.
fine. And you did full face-to-face classes.
Yes, sir.
Yeah,
Whenever
and
possible, I attended those lectures.
you attended. And that was way back in which year you started with the DAMS face-to-face?
So it was 2019.
Okay, so that means
December.
कि you did some of the classes during COVID and lockdown also
So during COVID, I attended online lectures from my home.
online. Hmm.
Yes, sir.
Okay, okay, fine. So tell us कि how did means कि what was your planning to crack this NEET PG exam? कि which subject you focused upon more and what sort of preparation you did? Like you did notes, you did TND notes, you did DBT. So what was your planning means कि in the preparation?
Yes, sir. Sir, I have heard from of my seniors and from many of the interviews that first and second prof subjects form a major chunk, and they help to crack questions from this third or fourth final prof. So I focused on my first and second prof. I used to make my own notes, especially for pathology. I made my own notes. That gave me a lot of confidence, and the lectures also helped me a lot. Then during the third pre-final year, I completed my final year subjects, the core subjects like medicine, surgery, and obs gynae. And during the final year, I completed my other short subjects, and after that, I studied revision.
Okay. And revision was self revision or on the pattern of test and discussion?
So it was self revision. I used to follow my own routine. That suits me. I used to do anything that suits me. I used to find my weak subjects, and then I used to work on it.
Okay.
Uh,
And during your hectic internship, how did you manage?
so actually, I could not basically handle my studies well with my internship. And even in the in the month of March, I had this some very busy postings, so I could not handle it much very well. So my INICET attempt was not that good. So after that I got my time, so I started studying well, and I my first mistake was I didn't give any GTs well. Like I could not even sit for 3 hours. 3 hours used to seem like a lot to me. So INICET was like eye opener for me. After that, I realized just mugging up things will not help. I will have to give more and more GTs. I have to work on my uh, answering skills, and I realized that after giving GTs, you remember things well, the weak points. I strengthened all those subjects which were weak for me in INSET just using GTs and reviewing them.
Okay, so that means ki giving GTs was a game changer for you. Means ki earlier you made your notes, your own handmade notes,
Yes,
you did self revision, but with GT you get the idea ki how to prepare for the MCQ and how to rule out the option and how to master this skill.
so passive reading gives you a pseudo sense ki you have completed a topic, but it actually doesn't help in the real exam. uh, in real exam you get easily confused between so many options, and when you have given so many GTs, the exam doesn't feel like some different exam. It feels just like a different GT
Okay,
you have
and
been giving.
what was your score during those GTs when you gave? How many question you
So,
got? Uh,
so in the starting, I was stuck at 120 to 130. It was
uh-huh.
very bad. Then I started working on it. After INICET, I reached 140. Then it took me a month to reach 160. Postponement of NEET PG was a blessing for me. So,
Mm-hmm. Okay.
so
And how
then I
did
worked on
you
it.
reach from 120 to 160, 65 correct? Means what was means ki what was your strategy to increase your score?
So when I was getting 120 correct, uh, I realized that I have not even completed my one complete revision well that I remember. I do not remember things that well. So I went to some revision lecture videos, revision notes, short notes, and I went to short notes that I have prepared for some subjects like Obscani. So that helped me a lot to grasp the subjects. I realized that you need to have some basic knowledge. Then after giving duties, you get on more additional knowledge to work on it. You do not have to know everything. You just have to know some things to solve the sub questions. You have to exclude other options and you have to find out the correct answer.
Yeah, that means ki the art of solving the MCQ is not the full
Yes,
knowledge, but a smart knowledge to get a correct answer.
yes, sir. You can not blindly guess things, but you have to work smartly there. You have to think everything about you, what you know about that, and then you have to come to an answer.
Okay. And during your revision, you did DBT also?
Yes, I did. I attended DBT in my final year. I didn't attend internship year.
Okay, but you did attend in the
Yes,
final year, and that must have give
yes,
you idea ki how to मतलब revise the topics in a less time frame.
yes, sir. Sir, it helped me realize that everything that is in notes, main notes, it's actually not asked in the exam. There are some very important core areas which are asked repeatedly, and you will get them wrong repeatedly if you don't focus on them and you don't study them well. They ask you the same topics, same areas again and again, just changing some words, and the answer changes again.
So with the DVT, it helped you in making a focus on
Yes,
key what points are important for your exam.
yes.
Yeah, and you did some marathon sessions also, the revision sessions.
So I attended the marathon session for some subjects in for INICET, but after
Okay.
that I didn't.
Okay. And this NEET PG, how many questions you have attempted and how many correct you have got?
I attempted 197, and my score is 663. So I'm guessing it's correct answer, correct questions maybe around 170, 170 to
170.
170.
170. So your GT score was 160, 165. Now in NEET PG, it is almost similar ki 170 around.
Yes.
Okay. And in the last few days, which subject you focused upon maximally?
So I have actually made a diary in which I used to write all the things I have to study again and again, all the facts. And in the front end and the last end, I have written all the mistakes I have made in the GTs. Like I said, I have covered some subjects which were my weak subjects like biochemistry, microbiology by giving GTs. I wrote those topics. I made short notes on those topics. I prepared some sheets on that notebook itself, and that I did that in the last week. And
Okay.
I attended custom modules, and I saw in the exam that I realized in the exam that similar questions were there in the
Eh,
exam
in
also.
the exam. Okay. And according to you, this exam was easy, moderate, or on a tougher side?
So it was moderate and
Mhm.
can be moderate to tough.
Moderate to tough. Okay, fine. And you were expecting this result? You were excited after, or you? Uh,
So after giving the exam, I was very excited. But after seeing so many records and everything, they they made me. They were confusing. The situation was
oh,
tricky.
plus
So
minus.
I
Uh-huh.
just thought ki, so anything can happen. I
Okay.
have to be ready for anything.
Uh-huh. Okay. And when you attended DAMS classes offline and online, so which
Yes,
subject
sir.
you enjoyed the most and which teachers motivated you most?
Sir, first of all, you, sir, how the way you have taught CVS cardiovascular system, no one can explain it better like that. I could not have uh, able would not have been able to remember all those things if it were not you. So first of all, I'm very grateful for you to you, and then I also enjoyed Dipti ma'am's lectures. Her notes were her. I didn't have to add anything to her notes. You covered everything. The same things were asked everywhere. So I revised only those notes. Also, in the last 1 week, I revised only those notes. I highlighted things in the notes itself. So yeah,
Okay.
this was
And how did you manage your college, your internship with preparation? Means ki, how do you get time? Because students, they do complain ki, that they do not get time, they get exhausted, they get tired. Therefore, they are not able to attend the classes. So how do you manage that? Means ki, what was that motivation factor, or was that a fire in the belly, or what?
So first of all, there is a motivation factor that you have to crack it in the same year. I wanted to crack it in the my internship year only. I
Hmm.
didn't want to spend 1 year again for this to read the same things again. It
Yeah.
would have been very boring for
Hmm.
me. So, so first was that, and second, it's not like I was perfect in uh, maintaining my dividing time between this internship and studies. I just used to do study a little bit here and there. Sometimes while walking, I used to do some question banks and all. But the main study happened after I completed my internship. It was hard, uh, but in some months, like PSM postings and all, which are easier, you can complete some very core subjects very well,
Okay.
and
Fine.
you can go for revision lectures if you feel like the main notes you have made are too much for you to revise.
Okay. Mhm. And some tips to your junior or future NEET PG aspirants, what will be tips from your side so that also crack this exam in their internship?
I will say don't overwhelm yourself with all the things there are in the market. Don't overwhelm yourself with FOMO. Just read whatever you have. Make some basic concepts in your mind, and then just to gather more and more information by giving GTs and all. Take it simple, then it will seem easier.
Okay.
Making
So
it
that means
complex will not help.
so rather than lots of resources, be
Yes,
focused on one particular main resource, give GTs,
yes,
and keep the thing simple. That is most important. Keep the thing very simple.
yes,
Yeah,
yes.
good. And you have got a rank of 110. So what are you planning to take as your PG branch?
So I am planning to take a surgery right now. I am considering other surgical branches also.
Okay, so you are a surgery person. Good, great. And all the best wishes from our side. And once again,
Thank you, sir.
congratulations from DAMS and DAMS family. You have done such a hard work, and your parents will be very proud of you. And we are also proud of you as a teacher, because
Thanks a
parents
lot.
and teacher are the two people who will feel more proud.
Yes, sir.
Friends will feel jealous, but these two people will be proud of you.
So I am happy to have some good friends, very good friends. They were
Yeah,
very happy to know my result,
yeah, yeah.
and
Hmm.
my parents were obviously very, very happy.
Yeah. So enjoy your these days before your counseling and before joining the PG. And once again, all the best from our side.
Thank you, sir.
Okay. All right.